about diet and exercise and how that influences our brain health for good or for bad. And today we are going to dive deep into sleep and stress. You have noticed that we are recording this program. So later this afternoon, you will get a follow-up email with a copy of this recording, a copy of the slides. I'll also send the slides from last week about diet and exercise. And you'll get a copy of our upcoming programs as well. So next week, we're going to be talking about socialization and cognitive fitness and how those are influences on our brain health and how to make those positive influencers. Just real quick about the James L. West Center. We are a not-for-profit organization and we serve persons impacted by dementia. Whether they are here, we have a long-term care residential community. We have our education that y'all are taking part of today. And we do have a day program. It is currently closed because of COVID, but we are actively looking at how to get that back open as soon as we possibly can. And again, those influencers on brain health. We have the diet and exercise we talked about last week, and today sleep and stress. These 6 areas of well-being essentially have been proven with different tests, different clinical trials, several in each area that really have shown that when we practice good choices in each one of these areas, we are going to influence better brain health. So we're going to age cognitively better. Also, the great thing about that is when we're aging and practicing good choices in these areas, it's not just cognitively that we're going to age better, our whole body will age better. Just real quick, a quick overview, causes of memory loss and confusion. We here at the West Center, we specialize in progressive dementias. These are your Alzheimer's disease, a vascular dementia, frontotemporal dementia, dementia with Lewy bodies. These are progressive dementias or diagnoses that we know will become worse over time. And if somebody doesn't pass away from something else, they will pass away from that progressive dementia diagnosis they may have. And dementia is that umbrella term. There's about 130 different types of progressive dementias underneath that umbrella term. That are, again, progressive and I guess chronic would be a good way to say that. And unfortunately, they do have a terminal diagnosis. These are the progressive dementias. But I also want to stress that Alzheimer's disease and these related progressive dementias are not a part of normal aging. We talked about, one of our biggest risk factors for getting one of these is our age. The older we get, the more at risk we are. But that does not mean it's inevitable or that we're going to get it when we hit a certain age. It is unfortunately becoming more common, but it's not inevitable. It's not a normal part of aging. But we do know, however, also there's a lot of other things that can cause memory loss and confusion that are not progressive neurodegenerative diseases like your Alzheimer's, those progressive dementias. There's a lot of things that influence our cognition and our memories. So you can have an infection or an immune disorder that can cause some confusion, can cause some memory loss, maybe some personality changes. Heart conditions, if our heart's not working well, our brain's not going to work well. They're directly connected. So if we have some unmanaged heart condition, or we're pre-diabetic, or we're having some lung issues that can be caused by sleep apnea, we'll talk about, that can cause some memory loss, that can cause some poor confusion. Any metabolic disorder or nutritional deficiency you might have. And this can be poor eating habits that we briefly discussed last week, but it can also be our body's just not making what it needs to make. Any side effect from medication, lifestyle choices. So if we're abusing drugs and alcohol, or we're not managing another chronic illness that we may have. Unmanaged stress, again, which we'll talk about. All of these things can lead to some confusion, poor memories, brain fog, whatever it is, but it's not considered a progressive dementia, like your Alzheimer's disease or vascular dementia. One of the great things, and I'm so glad y'all are listening to these programs, is because a lot of what we do every day, the choices that we make can influence, for better or for worse, how our brain's going to work. And also how the rest of our body's going to work as well. So diving right into sleep. Brain health and sleep. As we age, our sleep patterns change. And you may have noticed this yourself. Common changes or common reports or complaints, I think, from people as I'm having a harder time just falling asleep. I wake up more often during the night and I can't go back to sleep. Spending less time in deep sleep, or when I wake up, I just don't feel restored. I'm still groggy and really tired. I'm sleeping less. I'm just not as tired. A lot of things can cause those sleep issues as we age. It can be medication side effects. It can just be poor sleep habits too. What are we used to doing? And we're just stuck in that habit. Grief, worry, and stress. Life happens, and sometimes that can interfere with our sleep. Unmanaged chronic illnesses, unmanaged pain that we're dealing with that does influence our sleep or affect our sleep. Maybe we have too much downtime and we're too sedentary, so our bodies just aren't expending all the energy that it needs to expend. And then if we have any other sleep disorder, like if we do have sleep apnea or a restless leg syndrome, insomnia that a lot of people can deal with, a doctor can diagnose and help us with those certain sleep disorders. And we'll talk briefly about that too. So some studies have shown, several different studies come to the same conclusion. When we sleep, our brain goes through a process of flushing out any built up waste that happens just because the brain works hard and cells kind of build some waste. So these studies show when we sleep through our cerebrospinal fluid, the brain flushes out any waste and clears away that waste in our brain. And that includes some beta amyloid buildup that some people might have. A beta amyloid buildup has shown, or is a common hallmark in persons that have Alzheimer's disease. They have excessive beta amyloid in their brains. So this doctor has said the restorative function of sleep may be due to the switching of the brain into a state that facilitates the appearance of waste products that accumulate during wakefulness. So again, it's just reiterating that when we're sleeping, our brain works hard to clear out some of that waste. They've also shown a lot that study how sleep helps take in all the information from the day, everything that we're learning, that we're doing today. It goes into our hippocampus, but when we're asleep, it takes it from that hippocampus, kind of that first barrier, and then stores it throughout the brain, either in our frontal cortex or where it needs to go in our brain. The hippocampus, just kind of a sidebar, is that first area of the brain that persons with Alzheimer's disease that starts to be affected. So when we're taking in everything from the day and it kind of goes into our hippocampus and stays there, and when we go to sleep, it gets processed and put through the brain and stored where it needs to be. That's where we might see some of that short-term memory loss issue in persons with dementia, because that hippocampus is being damaged. And so if we're not sleeping well, we might notice that maybe our memories aren't there. We're having some problems with that short-term memory loss because it might be the sleep's affecting how the hippocampus processes information from the day. What sleep also helps us do is merge existing information or new information with knowledge, past knowledge that we have. So it connects our past experiences with new information. So we can make better connections, better problem solve. It helps us process and solidify fact-based memories and any other memories. It really helps solidify, of course, processing those new memories, but solidifying memories that we already have and knowledge that we have, reinforcing those procedural memories that we do every day, kind of without thinking about it. And it helps us process emotional memories. And if you think, you say, well, let's sleep on it. This is bothering me, or I'm feeling worried about this. Well, or I have a big decision to make. Well, let's sleep on it and see how we feel about it in the morning. That helps us process those emotional things better. If we have an upsetting day, we might feel better the next day because our emotions have been processed correctly. And then chemicals are released in our body that help strengthen our immune system. Our muscles get to restore themselves. Good quality sleep really affects all parts of our body. But there is such a thing as sleep deprivation. And this can be, I'm just not feeling rested. I feel groggy still when I wake up in the morning. I'm not energetic. I'm fatigued throughout the day. So several studies have shown this, the first one on this bullet point. It's a study of mice, but researchers found that sleep deprivation does increase the concentration of harmful plaques in the brain. And those harmful plaques is beta amyloid and tau protein that do build up and that we see in persons with Alzheimer's disease. And we all know that when we don't sleep well, we're not thinking as fastly, thinking as well. It might affect our mood. It can put us at greater risk for developing dementia as well. Sleep deprivation has also been shown to cause or increase inflammation inside of our body. So it can be inflammation on that increases risk for heart disease. It increases risk for diabetes, cancer, again, dementia, stroke, all of those. And also studies have shown that insomnia can be related to our bodies making this, our body's a hormone making system. And so it lists here the hormones that control our hunger. When we're not getting enough sleep, those hormones that control our hunger may not be working as well, or the body may not be producing them as well. So it also changes how much we eat, how much we're able to stop ourselves from eating, not going to the refrigerator late at night. It can make you gain weight. So sleep, really, the studies are showing, particularly when it comes to brain health, the important part of sleep is the quality of sleep. And when we go to sleep, what we should be doing, what our bodies should be doing is going through a sleep cycle. And one cycle has about 4 stages in it. And we want to be able to go through at least 3 to 5 cycles a day or a night in a full cycle. So the cycle, one cycle has, again, those 4 stages. The stage 1 is we're easily aroused. Stage 2 is a deep sleep, and it's accounts for about half of our total sleep. Sleep 3 is that deepest stage of sleep, and that's where our bodies release these hormones that help regenerate and restore brain muscle tissue, and regenerate a lot of stuff within our body. And then we go into that stage 4, that REM, dream stage that you've heard of. And this is about a quarter of our total time of sleep in that one cycle. That REM stage is important for brain health. We have to go through stages 1, 2, and 3 to get there. But this brain activity during the REM cycle, or that 4th cycle, is heightened. Our brain activity is heightened. And this is where they're finding that we consolidate all that information from the day, that we take it from the hippocampus and store it where it needs to go. This is where our memories are strengthened and solidified, and where we process all that stuff. But we have to be able to go through each stage in each cycle. And the best recommendation is you have 3 to 5 cycles a night. And the Harvard research suggests for every hour you're awake during the day, you need a full half hour of sleep time to process the new information that you've learned. So take that for what it's worth, how many hours of sleep you need. So tips to getting more sleep. We're going to go over some general tips, but we're really talking about a sleep hygiene and how do we incorporate a sleep hygiene in throughout our day. We want to stick to a schedule. You want to get up around the same time and go to bed around the same time. And you want to do that every day. Not just during the week and then on the weekends you think you can sleep in, it's fine. It's really doing it about and sticking to that schedule every day. Creating a bedtime ritual with relaxing activities. We'll talk about what those relaxing activities look like. And turning off electronics and dimming the lights as well. So our brain, when our brain sees light, whether it's sunlight or it's light from electronics, it does not set the body into process to go through or release melatonin, which is a hormone, and melatonin promotes sleep. That if our brain sees light, it's not going to release that hormone. So, and I'm guilty of this, but I might have all the lights out in my house, but I'm staring at a big TV, watching a movie, and I'm staring at light. And it could be 11:30 at night. I'm not really tired because my brain hasn't started that wind down process for my body that my body needs to go through. Watch what you eat. If you're prone to, gaseous foods, or you have heartburn, you don't want to eat those late at night or maybe even late in the afternoon. No caffeine after 3 or even earlier. So we know as our body gets older, we don't metabolize things as fast. Our metabolism slows down. So caffeine can stay in our system a lot longer, as well as some, medications as well, if those are having some effect on your sleep too. So being aware of that. And avoiding alcohol as a remedy. Alcohol is common to help people fall asleep fast. But what studies have shown over and over again is alcohol does not allow the body to go through those 4 stages in each cycle. So you're not getting the quality of sleep that you need. Even though you got to sleep fast, you got to go through that quality, those cycles, each stage and each cycle. And if you are, we'll talk a little bit about some sleeping pills and over the counter. We'll talk about those, but really short time use on those. And obviously talking to your doctor. If you really are having an issue and a problem, you really want to be a partner with your doctor and advocate for good sleep. But another thing to do is the sleep hygiene, and thinking about it as a hygiene, because it's a day-long process. It's not just when we think, oh, I should probably go to sleep in about 30 minutes, I need to relax. This day-long process is what really helps us get our sleep patterns back in check and keep them steady and consistent. So in the morning when you wake up, they suggest that you go ahead and get sunlight within, the first hour. If you get sunlight in your skin, and that can be, you can go outside and go for a walk, or you stand outside, you just open the windows and you have sunlight come in, that helps the body reset itself, that circadian rhythm. Again, waking up about the same time every day, and exercising every day, moving more throughout the day. Exercise improves your quality of sleep because you're going to be more tired. It helps you be drowsy at night. They do say the earlier you exercise, the better. It's going to be when you're going to exercise is going to be the best time, but you do want to make sure it's at least 2 to 3 hours away from bedtime, because your body is very energetic right after exercise. It takes it a while for it to wind down. And then when you come to the evening, late afternoon, evening, eat a light meal, avoid any stimulants, and this can be food, it can be medications, it can be alcohol, and really using your bed for sleep. Because our brain is going to associate what it does in bed with what it needs to do. You're kind of training your brain when you hop into bed. So if the thing you do when you hop into bed is play a lot of games on your phone, your brain is going to start to associate the bed with that fun time. Oh, great, I'm going to go play games on my phone, instead of associating it with sleep. So you really want to do, I'm not knocking games on your phone because I play them, but I want to do it away from the bed. So my brain really associates, oh, it's bedtime. Okay, it's time to go to sleep. This is what this area is for. So what are you routinely doing when you go to bed, and being aware of that, and making sure maybe you still do that, but you do that away from the bed and only go to bed when you're ready to sleep. And that's what you're doing, is sleeping. And then when it is bedtime, ease into it. Give yourself a little time to ease into that sleep. Turn the lights off, dim them, settle in. Create that bedtime ritual with relaxing activities. It might be that you turn on some soothing music, right? And you've got those lights dim. What is that bedtime ritual that helps you fall asleep? If you can't fall asleep within 30 minutes, go ahead and get out of bed and go do something that's relaxing elsewhere. So if it's reading a book, or if it's journaling, or whatever it might be, go do that in another area. And then you can come back to bed when you're sleeping. When you're ready, you're like, yeah, I'm ready to go to sleep. So then you come back to bed, helps that brain associate it. If you still can't fall asleep, we'll talk about non-drug approaches. We'll talk about over-the-counter sleep aids and prescription medications. But what we highly encourage and what we think you should do first is these non-drug approaches. If you really just can't fall asleep and you've done the sleep hygiene and you've done this. And this is progressive muscle relaxation is one technique to do this. And this is a systematic tightening and relaxing of the muscles from your head to your toes, or from your toes to your head. And it's the little bitty muscles. So you're squeezing your toes and you hold them for a few minutes and then you relax it. And then maybe you're flexing your ankles and you hold that and then you relax the ankles. And then maybe it's a tightening of your calf muscles and you hold that for a minute and then you relax it. And then tightening, you just walk up your body and you tighten and release, tighten and relax those muscles throughout your body, and that really can physiologically tire out the body and get you there. It also gets your mind focusing on something else if the mind is what's keeping you awake. Meditation is a great thing to try as well. And you're in bed, you're practicing deep breathing. So you're breathing slowly, you're using your stomach or your diaphragm to breathe in and out. And you're focusing on your breath, or maybe you're focusing on a word or a phrase, like I am relaxed. So you breathe in, and as you breathe out, I am relaxed and I'm getting sleepy, and you do it slowly and calmly, and you tell yourself relaxing things. And you can also try guided imagery. And this is a form of meditation, but you're imagining a relaxing or calm scene in your mind's eye. So you go there in your mind and you can see this calming scene. You're hearing calming music, or maybe you don't hear anything at all. Maybe you're breathing in some nice lavender that smells good and it's just so relaxing, and you're focusing on your breath. Whatever relaxes you, you go there in your mind's eye and use all of your senses, and this automatically puts your body into a more relaxed state, a more calm state, and it's much easier to go to sleep at that point. If everything else fails, and so let me say this, I'm not a doctor and I'm not a pharmacist. This is not medical advice, but we do put this a part of the program because we know people use them either way, whether we talk about it or not. But the best way to improve your sleep is do that good sleep hygiene. And I will say this, you've got to do the sleep hygiene for about 30 days. Holly talks all the time about to create a habit is 28 to 30 days. So you have to practice this day-long sleep hygiene for 30 days before it becomes a part of just what you do and who you are. And that's when you'll start to see the benefits of it. I don't want you to say, you know what, I tried that yesterday, it didn't work. I'm not doing it again. I'm going straight for the pills. We want to do this 30-minute or this 30-day habit. And that's when you'll really start to see the benefits of these non-drug approaches. But if people are using over-the-counter sleep aids, typically what a lot of people do is use antihistamines. Because it makes you drowsy, right? And antihistamines are also the main ingredient in those over-the-counter sleep aids like ZQuil or Unisom or anything like that is that antihistamine ingredient. Well, what studies have shown is that these antihistamines do make you feel drowsy, and they do help you fall asleep and can fall asleep easier and stay asleep for longer. But there are side effects that come along with those. You might have a little hangover effect when you wake up, which can increase your risk for falls. It can cause more drowsiness throughout the day. It can give you blurred vision. It can give you constipation. And there has been possible links in different studies shown that it can increase your risk for dementia if you have a long time use of them, a long time use. And the same for older generation ones and newer generations. So Unisom has a sleep tab that's a little bit newer. It's still using antihistamines. The side effects are they're still showing the same side effects as like the constipation and the daytime drowsiness. But they're also showing that there might be some strange side effects, like causing strange behavior, like sleepwalking. So being aware of this, and if you really are doing this, you really want to talk to your doctor about this and being an advocate about what's good for your body and what's not. There's also natural over-the-counter sleep aids. So there's melatonin. And melatonin, like I mentioned earlier, is a hormone that our body makes naturally. As we get older, our body may not make it as much or as well. So that can lead or be a possible cause is why we're not going to bed early or sleep early or not staying asleep for as long. You can get melatonin over the counter. Can help set that sleep pattern again. If you are trying this, obviously talk to your doctor about putting this part of your regimen and talking to the pharmacist about it. And maybe combining it with other supplements like zinc or magnesium can also help. Know that there also might be side effects of this as well. So this is why you need to be consulting with your doctor, because there can be headaches, there can be morning time tiredness, there can be daytime sleepiness with it as well. And then there's valerian. It's a plant-based supplement. I think it's fairly new. And there are some therapeutic, shown for some therapeutic benefits, but there's not a lot of evidence out there. It's very limited on the effectiveness of it, but it's something that you can talk to a doctor about. And then if you are with your doctor and they do prescribe a medication for you, so a prescription medication, you just want to use it with caution. And it is a constant check-in with your doctor and the pharmacist about these, because side effects, you want to know what the side effects are and you want to weigh them, and you want to be informed about those side effects and, risks and benefits of those. And they're just listed here are some of the prescription medications that are commonly prescribed. But also being aware of other medical problems that can also interfere with sleep. So if there's a heart or respiratory issue, so you're having a hard time breathing, that's going to interfere with your sleep. Inflammatory conditions or arthritis, if you're just can't get comfortable or you're in pain, that can cause restlessness and lead to sleep problems. Diabetes, you're having to get up a lot more in the middle of the night to go use the restroom. Or just you have the nerve issues in your legs or your feet or your hands, the neuropathy that can cause people just have disturbed sleep. Thyroid issues, prostate issues, kidney issues, all of these things. So just working with your doctor to being better able to manage those conditions will in turn automatically, hopefully better increase your sleep quality and quantity. Because that's what we're looking for, is really the quality when it comes to cognitive health. And then there's mental illness. Some mental illnesses can cause sleep disturbances as part of the diagnosis. So it can be generalized anxiety disorders, there's panic attacks, or can be depression. About 90% of persons with serious depression experience insomnia. So being treated and seeing the right doctors and right treatment options for all of these conditions. And then some neurologic disorders. So dementia, part of having a progressive dementia that can disrupt sleep patterns. Epilepsy, if you're living with strokes, Parkinson's disease as well. Living with headaches, but Parkinson's disease. These all will interfere with the sleep-wake cycle and what's happening with the brain. But managing all of these conditions and having the right treatment plan and talking with your doctor and having a good care partner team in place is going to help with those. So I'm going to switch to stress, and then hopefully we'll have a few minutes left over for some questions, but diving into how stress interferes with our brain health. And stress is how we respond. It's how our body, our mind, our emotions, our physical health, and our behavioral health really respond to any perceived change, demand, or event in our lives. What happens physiologically when we go into a stress response? And I'll say so the key word here is perceived. Everybody stresses about something differently. There's not a wrong way or a right way to stress out or about what to stress out on. It's what we perceive as really a threat or a change in our lives. And that's when we go into a stress response. So it can be, I got into a fender bender on the highway. Whew, yeah, that's going to stress me out. And I go into this stress response. But it can also be a diagnosis. It can be the loss of a job or the loss of a loved one. It can be the loss of a pet. It can be a pandemic that we're living in, right? We have a stress, something stressful happens and our body goes into this stress state. It's a physiological response. Our blood pressure increases, our heart rate increases, our muscle tension increases. It goes physically, some people might do this, I do it. Our breathing becomes more shallow, it becomes rapid, and our cortisol and our adrenaline increase in our body as well. Cortisol is that stress hormone, and adrenaline is part of the stress response, but it also helps us move faster and think faster. We'll get this to in a second. What's also happening is our immune system's not working as well. For a short period of time, these changes that happen in our body are good. That's not a bad thing because it helps us get through that stressful event. It helps us pull over on the side of the highway if we get into that fender bender. It helps us take in some information and make some decisions, quickly, or what are we going to do next? It helps us for a short period of time. And we're meant to go into this state, okay? Our brain activity also goes up. But you can see here on the slide, the stressor, what happens is when that stressor is gone, or it's being managed well, our bodies relax and it goes back to our normal state. It goes back, our blood pressure goes back down, our heart rate goes back down, our breathing, it evens out. Our digestive system and our immune system start working better. Our muscles start to relax, and then our brain stops dumping that cortisol and adrenaline into our system. So our bodies go back to this relaxed state when the stressor is gone or when it's managed well. What happens though, when we have long-term stress and we have this stressful thing happen, a diagnosis, right? Our body goes into this physiological response and we're in this hypervigilant state for months, years, maybe even a decade. For some people at a time, and our bodies are in this state because the stressor doesn't go away and we may not be managing it well at all, or things change every week, right? So we got this new thing, this new stressor, this new thing I got to deal with. And that stressor never goes away. So our bodies never get to relax. Neither do our minds or our emotions. So what happens is we go through or we start to see these physical effects or these warning signs. The physical effect you have listed here, not an exhaustive list, but you might start to see some sleeplessness, headaches, nausea, that digestive system. So all the attention when we're in that hypervigilant state, all the attention goes to our vital organs, right, to keep us alive. So that digestive system doesn't get enough attention. So you can see you get some IBS in there or just really bad stomach issues. You have this elevated blood pressure for a long period of time, which is not good on your vessels or your heart. Increased heart rate. You might have fatigue, a lack of energy, more dizzy, just dizzy throughout the day. And you're getting sick more often and you stay sicker for a longer period of time. So these are some physical warning signs that we have some unmanaged long-term stress because the body's in that hypervigilant state and it's starting to do its wear and tear on the body. Mentally, what we see when we have this long-term stress that's not being managed well is some warning signs as we ourselves might become forgetful or have some cognitive issues. That cortisol hormone that our brain releases, after a while, that long-term effects of that cortisol being put into our bloodstream starts to attack the hippocampus area of our brain. Again, that hippocampus is that area of the brain that first is affected with Alzheimer's disease. That's where we have that information we taken from the day. That short-term memory stuff needs to get stored where it needs to be. But if that cortisol is interfering with that hippocampus, you might see some forgetfulness with unmanaged stress, decreased concentration, just not being able to focus on what I need to focus on for a long period of time. More confusion, can be more accident prone or not as aware of some risky behavior that you might be doing. Can be distressing dreams. So you got some sleeplessness, but you're also having distressing dreams at night. I'm starting to blame others for everything that's going on. And then we have warning signs of emotional stress. So if we're in this hypervigilant state for a long period of time, you're going to see effects physically, mentally, and emotionally. And I have on here just kind of a side note that grieving is a natural part of caring for somebody that has a dementia, a progressive dementia. So because we're listed here, anxiety, depression, guilt, resentment, anger, fear, moody, sadness, nervousness, hopelessness, all of these feelings are normal reactions to caregiving for somebody with a dementia. There are also feelings that come along with grief. So you do want to ask yourself, am I overly stressed right now? Am I not managing long-term stress, or am I grieving? Or is it both, right? Do I need to grieve and experience the feelings of grief and also manage some higher stress? And then behavioral effects that we can see, these warning signs. You can withdraw socially. You can also withdraw inwardly, right? I'm not going to deal with this emotion right now. I'm going to ignore it and set it over here. Maybe it'll never show up again. Or you just withdraw and distance yourself from your people, from your peers, your friends, your hobbies. You can see a change in eating habits, and this is where you're not eating at all, you're eating too much, you're just eating McDonald's, whatever it is. A change in activity level, and this can be you're overly fatigued and you just don't have any energy at all, so you're not doing anything, to an extreme where you've got to be doing something all the time. I got to do this, we got to get this done, there's so much to do, I got to keep going. Got those energy levels or activity levels. Again, blaming others, becoming very quiet and not expressing emotions or sharing about your experience, or becoming overly talkative, just talking a lot. Self-medicating, this can be alcohol, it can be drugs, it can be food, it can be shopping, you name it. Being suspicious or starting to have some paranoia, being hypervigilant about stuff, and you're seeing relationship problems in other relationships and that throughout your life. And really just any uncharacteristic behavior, things that have changed about you. Excuse me. And I have these warning signs up here, these warning signs of stress, long-term stress, not to scare people by any means, but to really look at these warning signs as what I'm calling them, warning signs. This is a warning sign that, I've noticed I've gotten a lot more headaches a lot lately. I'm not sleeping well. I'm really irritable, and I've been snapping at everybody, just kind of overly angry about a lot of stuff. And I've withdrawn. I really just have kind of cut myself off from friends and family. And, I've noticed this about me. I see these warning signs as what they are. This is a warning sign, and this is what I need to do to change that. Because this is the effects of long-term stress. And I don't want that long-term stress. I want to be able to manage it better, particularly when I can't take away certain things, right? Like I can't take away a diagnosis. So I take these warning signs as a warning sign and be grateful for them. Okay, I've noticed this. So what can I do next to make a positive choice and manage my stress and care for myself better? So some tips is just recognize your limits. Be realistic about what you can and what you cannot do. Sometimes you might need to say no or later to somebody else, maybe set some boundaries with somebody else, or maybe sometimes that's saying no to yourself. You can't take that on. Setting those boundaries with yourself and with others. But also understanding what you cannot do and you cannot give what you do not have. So understanding that. And a lot of caregivers, I think really, and I say this because I can be guilty of this as well. I give and give and give, even though I don't have anything to give, to where it's detrimental to me. And then I can't help anybody. And that's not what I want to do, right? So we got to keep it simple and sane. It's the KISS method. Keep it simple and sane. Write down what needs to get done, prioritize it, and then take action. Decide what needs to get, and it can be a day-to-day list. It can be a morning list and an afternoon list, but write down what needs to get done and then take action, start doing it. But on every list that you write down, here's what needs to get done. Here's what I'm going to do today, is on every list is you've got to write in time for yourself. Because that is not an option. Time for yourself or self-care, and it can be 5 minutes, it can be 1 hour. You have to have that in there because you have to be able to take care of yourself so you can take care of others. Or you will get to that point where you have nothing left to give and then you can't help anybody. So there has to be that time. You have to prioritize making time for yourself, self-care. And managing your expectations. Managing your expectations on yourself, your limits, but also what the future might hold for you and your loved ones. It can be manage your expectations for your loved ones too. And if you're caregiving, it might be the person with the diagnosis, but it also might be your loved ones around you too, managing those expectations of friends and family. And being kind to yourself. So this is watching what you eat, watching what you feed yourself. And this is food wise, but also what you feed yourself on the news or TV that you watch, right? Making exercise a priority, practicing your faith or practicing those affirmations, those things that make you feel good and then give you that encouragement, and scheduling time for yourself. You are so good. Most people are so good to everybody else around them, and they're not as good to themselves. So we have to be able to be kind to ourselves. And practice gratitude. This is reflecting on rewards every day. What what was good? What was a good thing about today? Some days you might have a long list of what was good. Some days that list might be one or two things, but you got to practice and you got to focus on those rewards every day. And then you have to start practicing a state of relaxation regularly. So it's taking that physiological hypervigilant state and relaxing that body. And you can do that in a number of ways. But meditation is a great way to do that. We mentioned meditation's a really good way to help us go to sleep, promote that sleep. But it also has really been found to preserve the physical structure of your brain. Really that hippocampus area, which we've talked about a handful of times, it keeps that hippocampus strong and it can actually grow the volume of the hippocampus. And it grows the volume of the amygdala. And the amygdala is our emotional center of our brain. So it's responsible for fear, it's responsible for anxiety, it's also responsible for joy and happiness and all that. So I want to make sure I have a strong amygdala. And you can do that through the meditation. Other ways to relax are the deep breathing, the guided imagery, music. That progressive muscle relaxation is also a way to relax your body. Using music, using exercise, practicing gratitude, talking about it. And this can be talking about it with a trusted friend. It can be talking about it with a counselor, a support group, maybe a religious leader in your life that you trust. It's just talking about what's going on, good, bad, and ugly. Laughing, journaling, getting a massage, reaching out. Maybe you haven't talked to that friend in a long time. You just need to reach out and talk to them. But it can also be reaching out to a counselor or somebody that can help you find different coping skills that are great for you, that work best for you. And learning to say no and practicing spirituality. So real quick, our emotional well-being is important to managing our stress. And a lot of studies have shown is you really are what you think. That saying is you are what you eat, which is very true. You are what you think also. This is very true as well. So they are saying you can help your brain and reduce stress by thinking compassionately about yourself and reversing any negative thoughts. You can actually physically change your brain, form new pathways, new neuronal connections in your brain, positive ones, and you can weaken old negative pathways in your brain. So the studies that they've done, and they did studies on people that had negative thoughts about getting older. So they just had getting old is just going to be bad. I've seen so many people go before me and it was just a bad experience. So this is, there's nothing good about it getting old. Those negative thoughts. So the studies were showing that the people that had those negative thoughts about getting older really had a harder time as they got older. They had more illnesses, they had more falls, they were on more medications. And individuals that had more positive thoughts about aging, like I can't wait to get older and I have more freedom. I can retire and I can go and do and spend more time with friends and family. And they were excited about getting older. They aged better, on less medication, didn't have as many chronic illnesses, and just physically were healthier. And cognitively we're healthier. And it really was, they have come down to it's how they thought. Those thoughts affected their health. So we believe, and this was Rebecca Leedy, she was a study lead on this study. We believe it is the stress generated by the negative beliefs about aging that can result in pathologic brain changes. Negative beliefs about aging can be mitigated and positive beliefs can be reinforced. So that the adverse impact is not as inevitable. So you say this worked for people that had thoughts about aging. Well, this works for any negative thoughts. So we can really change our negative thoughts and change our health and change who we are. So you are what you think. And having a good spiritual well-being in a spiritual community can help with that. So the spiritual activity, and this may look like it's a church you belong to, but it's just a group of, it could be a group of close friends that you feel support with and community and belonging with. But they do have more positive outlook and they're better able to manage negative thoughts. They have that sense of belonging, that community and trusted people they can talk through things with. It's intellectual engagement, social engagement as well. And it helps reduce that stress, because it can be through reflection and meditation that reducing stress. It can be through prayer or affirmations or scriptures, but it's that whole mind, body, spirit connection. And we as human beings are made up of the mind, body, and spirit. So just a few tips. Again, we want to strive for progress, not perfection. Make small changes and keep adding those small changes. So it might be, I'm going to make, with the sleep hygiene, I am going to every morning, I'm going to be, my change is to get out and be in the sun for a little bit. And then once you get into that habit, add another small change on there. You don't have to change everything all at once. You have better success of doing it, adding small changes over time than trying to change everything at once. Giving your sleep hygiene plenty of time to work. Don't just give it 1 or 2 days or a week. We got to give it that 30 days just to notice really good changes. And making time for yourself. Again, that time might be 5 minutes one day, but it's an hour the next day. And that's that time that you practice self-care. And have a variety of relaxation techniques that work for you. We can't always stop and journal when we stress out about something, or we can't always stop and go get a massage, but we can stop and do deep breathing. Or we can stop and maybe do some guided imagery or a quick meditation. So having a bunch of those techniques that I can pull from and use them throughout the day as I need them and as it's appropriate. And rewarding yourself along the way, that you really are doing a good job. This is also practicing that gratefulness, reflecting on those rewards. And develop a plan. Life happens and it really can knock us off track. But setting goals and being flexible, being okay that, I got off track here these last couple of weeks, but here are the steps I'm going to do to get back on track. And that's okay. Being flexible and being okay and being gracious, having grace for yourself about that. And of course, talk to your doctor, a trusted doctor, consult with them, especially if you're doing with the sleep hygiene or you're incorporating any type of medication into that. Or, some people use exercise as a stress relaxation response. So talking to the doctor about all these, making sure they're part of your care team and they really have some good information back and forth with them. So again, a healthy brain is really whole person wellness. It is that diet and that exercise, the quantity of sleep and managing that stress. Next week, Holly's going to talk about social engagement or staying socially connected and brain activity and how those influence our brain health for good or for bad. And there is our information. Attempt to do this. And there's plenty of time left. Is there anybody that has any questions or wants to share anything that they've experienced?
Jamie, it's Debbie Douglas. And so my husband has Alzheimer's, but last week he was also confirmed to have Parkinson's and through a DAT scan. And he's being tested this week for normal pressure hydrocephalus. They said his ventricle is enlarged, so it could be they're gonna do. I'm overwhelmed with the thoughts of how it all intermingles, and you just, how to move forward and stay calm. I mean, I am calm, but that's just a lot, and it worries me on how he will be. Mm-hmm. Because I know there's there's a lot of the symptoms and side effects cross over.
Right.
So kind of plans. I mean, you can't make a plan because every day is different than the day before. So I don't know. That's just kind of what I'm dealing with right now.
Yeah, the first thing that comes to my mind, Debbie, is a support group to help, get, because it is overwhelming. And there is, it kind of sounds like there's a calmness, but there's also this, overwhelmness, but also, okay, what now? What to, kind of what to expect, what's going to happen. And being able to talk into a group of people that have been there or going through the same thing can not only help manage stress, but can also help you talk through what's going on, what questions to ask, what have other people seen in the past. Potentially that can help. And really just practicing every day some time for yourself. I mean, can you schedule 10 minutes to where you meditate on, here's a vacation I can go to in my mind, and try and separate your thoughts from it. I'm sure it's extremely hard to do, but try and separate. Here's 10 minutes to where I can do this. Or it can also be what I find helpful when my mind kind of takes over. It is, well, I need to write down and physically write down rewards. What's good about today? What's good about this situation? Sometimes I have to think pretty hard, but that helps me slow down, take a deep breath, and okay, I have an action, set of things I'm going to do. I have an action plan and questions I'm going to ask, but there's this too. These are these good things. So.
Yeah. He also has two kidney stones that he's having surgery on September the 9th. I just had a brand new great granddaughter that I'm just going to take the time and go visit for 2 days. She lives in Vail, but our oldest grandson is coming over to stay with my husband. So I'm just hoping that it all works out and it's not too, because my husband is so clingy and just wants me right by him all the time. But anyway, yes, I'll do better about the support groups.
And I will say, we have a lunch and learn coming up next Wednesday. So September 1st at 11:30. It's about ambiguous grief and anticipatory grief, which can be very helpful. I mean, everybody, of course, is invited, but that can be very helpful to, that anticipatory, what am I anticipating, right? And this ambiguous, a lot of different griefs, a lot of different things going on, and how do I manage that, what that looks like, and how do I best manage in moving forward with those griefs as well. So it can be a really, really good presentation to be on, or we can make sure y'all get the recording of it too.
Yeah, that's when I'm supposed to be up in Vail with my great granddaughter, but I'll try to either call in or I'll be sure and watch for the video.
Yeah.
For that, because that sounds really important. Everything you do is important.
Yeah, and that might be very timely for you particularly.
Yeah.
So
yes, thank you.
So we did have a question in chat about people that cannot sleep for maybe more than 5 to 6 hours at night. And this has been just who they are, right? It's been a lifelong thing. And that's fine. Each person is different. So some studies show, when you think about the sleep cycles, you got the 4 stages in each cycle. Even if you take a nap in the day and you get through a full cycle, that's good. It doesn't all have to be concentrated in, that 7 hours or, 8 hours that they say we have to have. It can, I think they prefer that, it's recommended, but if you can get maybe 1 or 2 cycles and then you get another cycle here, it's about going through the cycles. The full stages in each cycle is what's been shown to be the most beneficial. And there will be a recording of this. So again, this afternoon, you will get a follow-up email. So you'll get a copy of the slides and the recording of this presentation as well. I'll also send out the information from last week's. We talked about diet and exercise. So you'll have that as well, and a link to a recording for that too, if y'all missed that. Is there any other questions or anything anybody wants to share?
For me, it's Debbie again. For me, it's hard to sleep without an aid because my husband makes a lot of movement. He talks in his sleep. He's scratching the sheets. He taps. And so I try to not stay all on one thing. I do melatonin. I do have something prescription, but I try not to. But I know how critical sleep is, so sometimes I just have to. Last night was a rough night.
Yeah.
And I ended up having to go sleep try to go sleep on the couch, which worries him. So
Oh, okay.
anyway, I'm just rambling.
Yeah. Yeah. And it's just really talking to the doctor and the pharmacist about those,
Yeah.
helpful aids, right?
Yes.
And even I've known some families that they were in the same room, but they had different beds that helped, because if the separation was kind of the issue, I'm in the same room, but I'm just in another bed. Might help. So.
Yeah.
Jamie, I had a quick question on sleep. I seem to get the sleep I need, but I've noticed in my mom, my mom has Alzheimer's. She's 93. There are some times where she won't sleep for 2 or 3 nights. She just doesn't sleep. They have her on sleep aids, but they don't seem to work. Is that seen across the board, or is that just something peculiar maybe to my mom? I just didn't know if that was very common. And then she'll like crash and sleep for 2 days.
Yeah, that's not uncommon, particularly with the dementia. I mean, for persons with dementia, there will come a time where sleep is going to change. And there might be 2 or 3 times where sleep changes for that person. And it can be that they don't sleep at all and then they crash. We've seen that a lot. It's not uncommon, but it's also talking to the doctor. Hey, this doesn't work. Or when she's in this state, is there something else that we can do? Or is this a phase? What's going on with this? But it's not an uncommon because of all the changes that are happening structurally and chemically with the brain. As that dementia changes, it's bound to happen. So
yeah, I have her in a facility, so I have a camera so I can see when she's sleeping. And I do notice there's other people in the memory care unit that sometimes will wander into her room at night and look out the window and wander back out.
Sure.
So I know she's not the only one not sleeping, but it just seemed like your brain doesn't function right without sleep. And if your brain's already not functioning right, no sleep is, I don't know.
Yeah. Yeah.
So
It's the changes that are happening.
Makes me feel better that it's just a phase possibly.
Yeah.
Thank you.
Absolutely. Well, we appreciate your patience at the beginning of this. So again, next Monday at 11, we'll talk about the socialization and cognitive fitness. So, and hopefully we'll send you the information about our support groups and other programs as well. Thank you all so much. We'll see you all next time.